Good morning, everybody. You guys can hear me? Barbados is a little
Yeah,
island in
yeah.
the Caribbean, 166 square miles, and mental health is an issue that is well discussed globally. So this is my area of research. Um, in my country, not much is known about bipolar disorder, so I just wanted to address the first misconceptions of the mental health disorder in my country. I hope you enjoy it. So, in summary. In Barbados, there are serious misconceptions about bipolar disorder, including the perception that it does not exist. In a country of about 284,000 people, there are those with the conviction that this disorder is not a present issue and that the ailing individuals are extremely deranged, viewing the behavior as an anomaly that they don't have the patience to understand. Imagine that this is a country where reports of our literacy,
Marlo,
yet
sorry
we
for
still
interruption.
such ignorance.
Marlo, sorry for the interruption. Kindly
Yes, yes.
enable. Kindly increase your volume so that other participants is not able to view. Get your voice. Yeah, kindly go to the microphone. See my navigation. Adjust microphone volume. You click it there. Get full. What is it?
My microphone is stuck. Oh, that's surprising. My microphone is already up tall.
Yeah, now we can
Can
hear
you hear
it.
me?
Yeah, yeah. Now it is good.
Right.
Sorry for the interruption.
Imagine
Yeah.
that this, no problem. Imagine that this is a country where we boast of our literacy, yet we spew such ignorance. That rate is a crying shame, and in Barbados we have a literacy rate of 99.7%, so by having this perception that bipolar disorder does not exist is really appalling. Continuing with investigation, other Barbadians had a clear indication of the disorder, citing emotional stress as a contributing factor, and gave examples of functional impairment. This research was conducted to increase the awareness of the disorder in Barbados, as well as to discredit the myths that were held by the general populace by educating them with the facts. So what? Why study bipolar disorder? Well, I just gave some of the reasons, but to elaborate further, there are those who are unable to cope with the mental and physical strains of dealing with a family member, or a significant other who may have the disease. These members are also subjected to the same level of stigma as the afflicted, sometimes even worse. This study will equip these persons with the necessary available information so that they, in turn, will be able to deal with the afflicted individuals without being harsh, mean, or even condescending. It also serves to reduce the prevalence of social stigma that is often associated with mental disorders. I mean, like, people will go to rent apartments and whatnot, and just because that they have a mental disorder, the landlords or even other tenants will want to shun these people and don't want to associate with them at all, which is ridiculous. I mean, this is 2016. We should be more knowledgeable and more cognizant of what we're doing. People feel what they don't understand, and that fear germinates through the inability to access information. Sorry for this mistake here. If the information isn't disseminated, then how can we know about anything? Sorry about you can't hear me. I will increase my volume. Background. Bipolar disorder, also known as manic depressive illness, is a complex, chronic, and severe mental health disorder that is characterized by episodes of mania, depression, or a combination of both. Bipolar disorder is a complex genetic disorder in which the individuals experience fluctuations in moods from periods of extreme elation or mania to periods of depression, which disrupts thinking and behavior patterns and sometimes includes delusions and hallucinations. That came from Cradle and Jones, 1990. It contributes to the global economic burden of disease, with treatment costs estimated to be about $7 billion, and approximately 73% of patients in the US experience a relapse within 5 years. It has also been ranked as the sixth highest medical disability in the US, as in 2005 may have changed since then. But recently in Barbados, there was a study about a girl by the name of Don Walton, who indicated that the stress of doing her dissertation while she was studying in UK acted as an emotional trigger for the onset of the disease. She stated that it caused her to be walking the streets at 3 a.m., not even knowing where she was going. Since she received her diagnosis after university, she said she felt relieved, but wished that she had known sooner, so that she could have taken better care of herself. She contends that although she is very equipped with the information and is making progress, she still has difficulties trying to balance work, relationships, and other commitments. That study and that story was actually conducted by an old classmate of mine called Kerry Gooden, who was a reporter for our national newspaper. So I found that story very interesting, so I just wanted to put it into my research article. Methods. This is how I conducted the research for this article. A server is employed to serve anonymous data. Sorry about this again. To serve as the baseline. Employees from four businesses, from management to the janitor, serve as respondents to discuss their views on disease etiology, functional impairment, behavioral patterns, and treatment associated with the disorder. Pedestrians are also part of the survey. From the survey, I was able to establish the misconceptions that were held by the average Barbadian. And I did this because mental health professionals will give me all their extensive knowledge about the disease, but I want to know what the average man would think about the disease and try to improve his knowledge and understanding so that because once information is shared, people will react differently and just treat these people better. Okay, so then I conducted interviews with mental health professionals who worked at the psychiatric hospital to debunk the myths associated with this disorder. They were asked several questions ranging from the prevalence of the disease in the country, age of onset of disease, violent behaviors associated with disease, sex most affected with disease, its prevalence where compared to other countries, and quality of care that mental health patients endure while they're at the psychiatric hospital. I mean, we have diseases in our country that we don't even know how it's caused, how it's spread. And in case of mental health, we see if a person is twitching or even acting funny, our reflex action is just to lock them up. I mean, that's ridiculous as adults, as logically thinking people. Results. Approximately 31% of the respondents had no idea what the disease was. A few even questioned its existence. One respondent even displayed a genuine lack of concern for the disorder and was quoted as saying, "I do not have the time to think about that." Another 15% of the respondents believe that there is not enough evidence, whether it's empirical or statistical, to validate the presence of the disease. Instead, as suggested by one respondent, these individuals may possess. He cited Ephesians chapter 6, verse 12, where it proposes that human beings were in a battle that was not of flesh, but of the cosmic forces that reign over darkness. These cosmic forces were responsible, according to him, for all of the delusions of the mind. However, 54% of the respondents were aware of the disorder. A female respondent was so passionate in her reply that she stressed that urgency needs to be paid to disorder and that people in Barbados consider it to be a joke. She continues to say that the affected persons require serious treatment and the appropriate attention because they don't get it. Another female respondent spoke about functional impairment. She told a story about her niece, who had a decent paying job at the bank, but was unable to sustain good social relationships outside of that environment due to her belief that everyone else was an enemy. She also agreed with the view that emotional stress, such as a bad breakup, as in the case of her niece, can trigger the onset of disorder. According to the mental health professionals, bipolar disorder is a mental disorder in which the episodes are not coordinated but occur sporadically. They provide statistics showing that bipolar disorder was the fourth highest mental disorder in Barbados, with the daily rate of those affected in 2013 being 173 per 100,000. They also show that women are more susceptible to the disease than men, especially during the ages of 25 to 29, with the average amount of healthy years lost being 310 per 100,000 compared to 258.9 in men. However, it is detected in both sexes before the age of 10, but is not as harmful. It is noted that Barbados exhibited the third highest prevalence rate of disorder in 2013, following only Cuba and Trinidad and Tobago. They also measured its increase over the last decade, which was shown to be about 3%. We know as whether we want to be professional as beings in public health or just human beings, that you respond to situations differently. So if you have a bad breakup involving, let's just say, children, or even if it's just spouses, we don't know how to react. Mental health issues can include depression. At some point in our lives, everybody gets depressed. So is a very serious issue, and the fact that this disease, bipolar disorder, is laughed at and scoffed at, that awareness needs to be improved and increased. So my conclusion is that bipolar disorder is not merely a fancy name that was created by scientists. It's a recurrent remitting mental disorder where the depressive episodes can be so severe that the afflicted individual can have suicidal thoughts and plans. However, without the efficient distribution of information about the disorder to the public, there would be an increase in the number of misconceptions about the disease. The individuals will also be shunned, exploited, and subjected to other unjust behavior due to ignorance. As Barbadians with such a high literacy rate, the number of fallacies that were spread about the disease was appalling. We all have rights, and these individuals should be no different. With the appropriate treatment and care, they can go on to lead successful lives, contributing to society. Future steps. Next steps on my research will be to utilize this information, this article, to educate people that do not know about the disease. So many people became more interested when I spoke to them about what I have found. One guy completely changed his view after he heard about its severity. He said that in the past, he was unable to deal with people like that. Now with this information, he could be able to cope with what they were going through and show more empathy. Yeah, ironically, when I first interviewed this guy about bipolar disorder, he said that one minute the people were good and then the next they freak out because he did not know about the disease. So that by conducting this research and just showing what I have found, that changed his view completely. He's more understanding, he's willing to talk more. Yeah,
Sorry for interruption.
I would also like to do further research on more mental health issues. I believe that a lot of these issues are not properly addressed, and several of them go under the radar. There's this view in Barbados that as soon as a person has a mental problem, the mental health professionals sort them away, claim that they are mad. I want to disprove this. Thank you, that's the end of my presentation. Hope you enjoyed it.